Hello everyone, this is Brainless Medico and I am Dr. Manoj, and today we are with one more important topic, introduction to neuroanatomy video 2. Neuroanatomy essentials for clinicals. So what every medical student must know. So I'm going to briefly give an introduction about what we are going to actually study in our playlist. So let's dig into it. And if you have not watched my video one part introduction to neurology, I kindly request you people to go and watch. So that is just a 5 minute to 6 minutes video, but you'll be briefed about what and how you are going to read your neurology system. So it is not similar to other discipline where you are going to just read and correlate, but this needs actually briefing about your previous knowledge. So I just made a brushing on your brief video about your neurology now, how you have to approach the neurology discipline. So just go and watch when you're free. So let's see, in this video I'm going to keep how you have to study your neurology, what under sections you are going to study neurology, and in the further sessions, like, we'll be seeing in great detail about every single topic in this video. So let's start. Neuroanatomy is a structural basis of neurology. A clear understanding of basic neurota is essential for neurological localization and diagnosis. Clinically relevant neuroanatomy focused on further rather memorization. The sentence basically I just copied from textbook. You have to remember, if you want to crack neurology, you have to be thorough with your basic knowledge and the upcoming medicine knowledge. So you can correlate your pharma, physio and anatomy so that you can localize the actual cause and treat the cause with a proper investigation without wasting basically time and money of the patient, which is most important, as we doctors are considered as a god and we have to respect their money and time, because basically you have to respect the time of the patient because you may lose the patient. So you have to be thorough with your basics and upcoming medicine knowledge. So I'll be trying to cover up mainly related to exam oriented, but I'll give the basic knowledge which if you are lacking from the anat or physio or your pharma. Okay, so let's start. Major division of the brain. So any idea? We'll divide brain into cerebellum, brainstem and cerebrum. Okay, so first we have cerebrum, largest part of brain divided into two hemisphere. So this is your brain, which continues as a brainstem, and from brainstem we have one extension called cerebellum. So I'm not a good diagram drawer, so but I think it's understood. Then lobes of cerebellum you have. In lobes of cerebellum you have frontal, parietal and temporal, and you have occipitolast. So frontal controls voluntary movement activity, speech, production, behavior and personality. Lesion causes voluntary motor lesion causes weakness, personality changes and Broca's aphasia. Don't worry, these lobes I'll be discussing very detailedly because individual lobes are 5 marker in oriented to anatomy, physiology and even medicine. So we'll be discussing it separately. So every subtopic, every individual topic we'll be discussing very great detailedly from this video. We'll take it as a reference. Then we'll be discussing parietal lobe in the further video. Then it is responsible for sensory perception, spatial awareness. Lesion causes sensory loss and neglect. This neglect you feel like interesting because I'll be discussing this, because if I discuss it here, video becomes lengthy and I don't want to make it. Neglect, just remember, you have a almari and your mom kept some key here and you'll be searching here and you will say, mom, it is not available here. Then your mom suddenly comes and show if the key is here and you are gone. That's what happens in the patient with the parietal lobe lesion. Temporal, and don't feel you have parietal lobe lesion, it's normal. Temporal lobe involves hearing, memory and language comprehension. Lesion cause memory impairment and Wernicke's aphasia. Occipital lobe responsible for vision. Lesion causes visual field defect. So yeah, this portion it is mainly related to vision. So visual field defect will be seen. Then coming to second one, motor complex, cortex. We have located in 3 central gyrus of the frontal lobe, controls voluntary movement of the opposite side of the body. Motor homunculus represents different parts of the body. Then sensory cortex, it is also similar to motor cortex. We will be discussing this also. Located in the post-central gyrus. This was in the pre-central gyrus. This is in the post-central gyrus. See, this is a gyrus. This is motor and this is what? Sensory, right? Don't worry. There are some legs, face and all. We'll be discussing it. Receives sensory input from opposite side of the body. So homunculus represents different parts of the body. Then sensory cortex, it is also similar to motor cortex. We'll be discussing this also. Located in the post-central gyrus. This was in the pre-central gyrus. This is in the post-central gyrus. See, this is a gyrus. This is motor and this is what? Sensory, right? Don't worry. There are some legs, face and all. We'll be discussing it. Receives sensory input from opposite side of the body. Subcortical structures. Subcortical structures. We have basal ganglia, thalamus. Basal ganglia involves in initiation and control of movement, and which, if there is lesion, it leads to movement disorders like Parkinsonism, a 10 disorders like Parkinsonism. A 10 marker, very important topic even under medicine, physiology and one more pharmacology treatment. So we'll discuss it separately in the 3 videos related to pharma, physio and medicine. So no need to worry, bro. Keep it on me, okay? Then thalamus acts as a relay station for sensory and motor pathway. There is a puppet circuit and all. We'll be studying that, and nucleus of the thalamus will be studying. So lesion causes sensory loss and altered consciousness. Brainstem. The brainstem consists of brain, midbrain, pons and medulla. Functions: contains nuclei of cranial nerve, 3rd to 12. Contains ascending and descending tracts. Controls vital functions like respiration and cardiovascular regulation. What is the clinical importance of this brainstem is? Brainstem causes, if there is any lesion present in the brainstem, causes cranial nerve deficit with long tract signs. Okay. Then coming to cerebellum. Cerebellum coordinates movements, balance and posture. So function of the cerebellum is maintains muscle tone, ensures smooth and coordinated movements. Then coming to its lesions, we see for clinical features ataxia, dysmetria, intentional tremors and nystagmus. Nystagmus, involuntary movement of eye. Then coming to spinal cord, extends from medulla to L1 to L2 vertebra level. Major tracts, corticospinal tract, it carries motor signals from brain to muscles. Brain to muscle, corticospinal tract. Spinothalamic tract carries pain and temperature sensation from, periphery to central. Then dorsal column carries fine touch, vibration and proprioception from periphery to central. And cranial nerves, we have 12. There is no confusion, right? Even sometimes I get confused with the cranial nerve names. So don't get confused. The first thing in physiology practical or in medicine, if you have CNS, they'll ask 12 cranial nerve names in the serial order and they'll try to confuse you. So don't get confused. Be confident and tell the answer. There are 12 cranial nerves arising from brain and brainstem. So they control sensory, motor and names in the serial order and they'll try to confuse you. So don't get confused. Be confident and tell the answer. There are 12 cranial nerves arising from brain and brainstem. So they control sensory, motor and autonomic functions of head and neck. So clinical correlation: cortex lesions cause contralateral deficits. Brainstem lesions cause ipsilateral cranial nerve palsy with contralateral motor or sensory loss. Cerebellar lesions cause ipsilateral coordination defects. I just stated because if you have not read medicine or physiology properly, you won't understand this. And explaining in this introduction video makes it lengthy and nowhere has any beneficial thing on you. So just leave this part. I'll explain it nicely. Just remember, I'll explain nicely. That's it. So what summary you need to remember from this video? This is not exam oriented video. If you want, you can skip this, but you can watch it if you want to become a good neurologist. Just kidding. Okay. Neuroanatomy becomes clinically useful when structure is correlated with function. Understanding basic anatomy allows accurate localization of neurological lesions.